Good evening, and welcome to tonight's live telephone town hall with Congresswoman Suzan DelBene, your representative for the 1st District of Washington. My name is Gordon, and I'll be moderating the conversation tonight. In a few moments, we'll be joined by the Congresswoman. Before we begin, I'd like to explain what will happen in the next hour. If at any point in tonight's call you would like to ask Congresswoman DelBene a question, simply press *3 on your telephone keypad. Again, that's *3. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. If you don't have a chance to ask your questions during tonight's call, please note you'll be able to leave a voicemail for Congresswoman DelBene and her staff at the end of the call simply by remaining on the line. Again, if you would like to ask the Congresswoman a question, please press *3 on your telephone keypad now. And with that, please welcome Congresswoman Suzan DelBene.
Thanks, Gordon, and good evening, everyone. This is Suzan DelBene. I'm Congresswoman from the 1st Congressional District, and thank you for taking the time to join us for this conversation. I look forward to talking to everyone about what I'm sure is top of mind in everyone's life right now, which is COVID-19. At any point in the conversation, as Gordon mentioned, please press *3 on your phone if you have a question. Also, I'm happy to be joined today by the Washington State Employment Security Department Commissioner, Susie LeVine, who can speak to the worker and employment resources the state has and how to access them, things like unemployment insurance and paid leave. And we're also joined today by Dr. John Scott from the University of Washington, from UW-Medicine. Dr. Scott is an associate professor of infectious diseases and is the medical director for telemedicine, and he'll be able to answer questions about the disease, how it spreads, and what you can do to stay safe. I know this is a very difficult time for our community, and I hear from constituents every day about their concerns around this outbreak and the impact it's having on their family. Many of you are furloughed and no longer receiving a paycheck. Some have had to find child care quickly because kids are out of school. Small business owners are wondering how they'll keep their businesses afloat if this goes on too much longer. Many of you are simply wondering how you'll get by and when life will return to normal. These next 2 weeks are going to be some of the hardest for our state. And while we may not be near each other right now, we're not alone. And that's why I'm eager to hear your questions during this telephone town hall. I also want you to know that I'm fighting for all of you. My priorities at the federal level are protecting families, workers, and small businesses, and getting our healthcare system the resources it needs to save lives. Congress has now passed 3 emergency funding bills to address this pandemic and to provide relief to our communities. On March 4th, Congress passed an $8.3 billion emergency spending bill that provided funds for vaccine development, telemedicine services, small business loans, and public health response efforts. In this bill, I championed a provision to make sure Washington state public health officials receive the resources that they need. And that resulted in an immediate $11.5 million for Washington state to help backfill budgets, as well as funds going forward as we continue to deal with this outbreak. And we want to thank our public health officials who have really been the tip of the spear on this effort. Then shortly after that first bill passed, the House began working on its second piece of legislation, which was the Families First Coronavirus Response Act. And this bill also included many provisions that I prioritized, including ensuring free coronavirus testing for everyone who needs it. In Washington state, this meant uninsured individuals and people covered by Medicare, Medicaid, and certain employer plans could get tested for free. And the governor also made that commitment to make sure that everyone who needs to be tested can be tested for free. The measure also enhanced unemployment insurance in Washington by waiving some federal requirements so that workers could begin receiving assistance immediately, since many had been out of work for some time already. And finally, we also protected nutritional security for at-risk groups by providing more funds for supplemental nutrition assistance, what we call SNAP, for student meals, for seniors meals, and for food banks. And then this most recent package was passed on Friday. The House passed a $2 trillion relief package, and the president signed it shortly after. The Coronavirus Aid, Relief, and Economic Security Act, or as it's called, the CARES Act, met a historic moment with a historic action. Our communities need support to get through this pandemic, and this measure is the largest relief package in American history. To help families and workers, the bill increases unemployment insurance by $600 weekly for 13 additional weeks, provides a direct payment of $1,200 for individuals and $500 per child for those who need it, and funds child care and early education programs for our children who cannot attend school right now. To support the economy, the CARES Act provides $375 billion in small business grants and loans to help pay for expenses. It puts guardrails and oversight on big businesses that receive federal assistance, like prohibiting stock buybacks and executive bonuses, and gives employee retention incentives to businesses closed because of COVID-19. And to make sure our healthcare system has the resources it needs to keep caring for us, the bill provides funds for surge capacity at hospitals, public health agencies, and more personal protective equipment, all of which we desperately need here in Washington. There are a number of other provisions in the bill that are specific to tribes, to veterans, and other local communities. And I look forward to your questions so we can give you as much information as you need. My office today released several resource guides on how the CARES Act helps different communities and how to access these resources. And so as you look for information, it is posted on my website, which is delbene.house.gov. And at the top, there's a link, a COVID-19 link that goes to all of our resources on COVID-19. And we put our guides up on the website there, and we'll continue to update that regularly as we get new information. Again, a reminder to any of you who have a question to press *3, and that will get you in the queue. And now I want to turn it over to Commissioner LeVine, who will give us a few words about what's happening with employment security at the state. So, and I also want to point out that Commissioner LeVine's first name is Susan with a Z, Susie, but her official first name is Susan with a Z like mine. So we're two of the Susans with a Z in the world out there. So thank you for joining us again, Commissioner, and I'll turn it over to you.
Thank you so much for inviting me to participate, fellow Susan with a Z. Representative DelBene and I have known each other for a very long time and used to work together eons ago in the private sector. So the Employment Security Department is an agency that really is designed to help people when they're in various transitions. We run the unemployment insurance program. We run paid family and medical leave. We also help with reemployment services. Many of you may be familiar with our WorkSource offices that we have throughout the state. As well as our labor market information and reporting on things like our unemployment statistics. We know what you all are going through, and we have our unemployment insurance claims agents hearing from many of you. Many who thought that they never would have tried to apply for unemployment insurance before. I want to assure you we are in this together, and we will get through this together. As an agency, especially during this crisis, our priorities have really become quite clarified. We have three main things that we're doing right now. One is getting people who are eligible for unemployment insurance their money faster. Two is enabling more people to become eligible. And three is helping employers find the people that they need for essential jobs, even temporarily, because most people would rather have a job than have unemployment insurance. Now, the first choice for an individual who has been impacted by COVID-19 in their work would be paid leave, and Washington has that. And we are also pleased that Congress passed that for businesses to expand that. Think of our four programs as an economic safety net. We have paid leave, we have unemployment insurance, we have paid family and medical leave, and we have workers' compensation. Unemployment insurance is really designed to be the best last resort. We have materials on our website, esd.wa.gov, to help guide people between these four respective programs in the different circumstances. As I think many of you may have experienced who might have applied for unemployment insurance, we have had a deluge. We have been so inundated, and I'll talk about those metrics in just a moment. But I'm going to really cut to the chase. What people need right now is reassurance of economic support during this crisis. And there are two factors that we have seen causing people concern that I want to address right away. One is that people are concerned that they won't be paid their benefits if they can't get through our phone lines. We are experiencing right now unprecedented demand, and while hundreds of thousands have successfully filed new claims related to the COVID crisis, many others have not yet been able to complete their application process. But rest assured, benefits will be paid from the time people separated from their jobs or otherwise became available under the CARES Act that Representative DelBene just mentioned, and not from the time the application was submitted or approved. So people will be paid retroactively, and they will be able to backdate their claims. People are also concerned that they will miss out on the new CARES Act benefits during the time that it's going to take us to get our system updated. As was mentioned before, the Federal CARES Act expands unemployment assistance to those not currently eligible who have been impacted by COVID-19. For example, those who are independent contractors, those who have fewer than 680 hours. And the CARES Act provides an additional $600 per week to all unemployment recipients through July 31st. Now, I've shared that we're working hard to have our systems updated, and we will be able to do that by about mid-April. But I don't want people to worry that they're going to miss out on any of those benefits. When we turn that part of the system on, we'll then be able to make retroactive payments for both the weekly benefit amount owed as well as the additional $600 per week. We have had a 1,000% increase in our call volumes over the past couple of weeks, and the highest volume of new claims since the unemployment insurance program began in the 1930s. We had an 843% increase week over week just the other week. We know it's been really difficult for people to get through on the phones, and we are so sorry that we've not been able to answer everyone's calls or emails. We know that this is frustrating and that it is making people anxious about getting their full benefit. So I hope that this reassurance that we are going to be backdating claims and retroactively paying those claims will help provide some level of relief to the stress that people are enduring right now. We're also working hard to improve the information on our website, update the technology, and hire more staff to address the tremendous demand that we're experiencing right now. So there are 3 actions that everyone can take right away. Please go to esd.wa.gov and sign up for our COVID Action Alerts. This will be where we provide information and instructions for folks about using unemployment insurance now, or for how to get ready for the way we're expanding it in a couple of weeks for the new CARES Act provisions. Please also, before you apply, go to that website to find answers to common questions and an application checklist on our COVID page that, again, you can find at esd.wa.gov. And if you are eligible, you should apply online for unemployment insurance. We do take applications over the phone, but really for only those who can't otherwise do it online. Fundamentally, if you are eligible for unemployment before the federal legislation passed, please apply as soon as you can, taking care to read the information on our website beforehand and double-checking your information before submitting your application. If you are not eligible, including those that are self-employed and workers with fewer than 680 hours, we ask you to wait to apply until our system is set up. Again, if you sign up for our action alerts, we'll let you know when it's set up. So we've been inundated, and we'd like your help in terms of self-serving yourselves for answering your questions and your needs during this time. A couple of other things. I know a lot of business owners are wondering what is available for them. There is a program called Shared Work that they can use in order to reduce the hours of their staff and not have to lay them off. We've expanded Shared Work to be available for those people who are overtime exempt, and we also are able, with the CARES Act, to have those businesses not have their rates increased if they utilize Shared Work. You can sign up for that online at esd.wa.gov. So fundamentally, we want to help, again, get money out more quickly to those who are eligible for the benefits, help more people access those benefits, and gain eligibility, and help businesses obtain staff for the essential jobs that they need. And on that last point, I would encourage you to go to worksourcewa.com and then connect up with your local WorkSource office. They are 100% virtual now in providing services and training, and there are thousands of jobs available right now where they desperately need talent into those positions. So thank you so much for being with us through this trying time. We are here for you and look forward to hearing from you soon. I'll wait for the questions until after Dr. Scott speaks.
Thank you, Commissioner LeVine. I appreciate it. We also, as I said before, we have Dr. John Scott with us. He's an infectious disease specialist. He can't give out individual medical advice, but he can answer general questions about COVID-19 and the response. So I want to thank him for being here, in particular just for all the work that he and so many of our healthcare professionals are doing to protect people through this crisis. And today is National Doctors Day too. So we want to honor you on National Doctors Day and appreciate you taking the time. And so let me turn it over to you, Dr. Scott, for your opening remarks.
Sure. Thank you, Representative DelBene. And first off, I just want to say thank you on behalf of all my colleagues, my healthcare workers. I want to say thank you to the public for your prayers, your thoughts, your food, the PPE that you've donated. We are truly humbled by this outpouring of goodwill to us. The second thing I wanted to say thank you for is for staying at home and social distancing. We know how hard that is, but it is working. As you may know, Washington was the first state to have a case and also the first state to have a death. But our increase has been much slower than other states, and that has bought precious time for us to prepare for a surge. And so we know how hard it is, but I want to let you know that it is working, and want to encourage you to continue to stay at home. There are a couple of resources that I wanted to let you know about. The first is called coronavirus.org. This is put on by the federal government and FEMA. If you have questions, that's a great resource. The Centers for Disease Control and Prevention, or CDC.gov, also has great resources, and then more local resources are available at Public Health, Seattle King County, and the Washington State Department of Health. I'll send it back to you, Congressman.
Thank you. Thank you, Dr. Scott. And now, Gordon, I think we'll open it up and start taking questions.
And just a quick reminder for those who are still joining us, you can press *3 at any time if you would like to ask a question. Up first, we have John Zhang. John, you are live on the call.
Yes, I am on the call. Thank you for taking my question. Yes. Hi, Suzanne. Thank you for taking my call. So I myself am a small business owner. I have an after-school enrichment business, and now we have been closed for 2 or 3 weeks, but we still have to pay monthly rent and utility bills, but we don't have revenues coming in. So I want to know how I myself and other small business will be helped.
Thank you for the question. I know that's an important one for everyone because so many of our small businesses across the country are extremely challenged right now, or shut down and furloughed because of the virus. So we've tried to address this in different pieces of legislation, but in particular, most recently in the CARES Act, we established a payment protection program to provide 100% federally guaranteed loans to employers who are maintaining their payroll during this emergency. We also have to make sure that the SBA has resources so you can get a hold of loans through the SBA. And some of those will also be coming through lenders who are eligible, so they may not be directly from the SBA. I also want to point out that all the things I'm talking about right now, if you go to my website at delbene.house.gov, you will see under the COVID-19 tab, there's a resource guide for small business that has a lot of detail beyond what I'll be able to say in the call. The loans allow you to do things like use it for payroll costs, use it for costs related to continuing healthcare benefits or sick leave, things like that. It allows you to help use it to pay for rent or utilities. And also part of the legislation we put together was loan forgiveness, so that because we know that that debt isn't necessarily something a lot of businesses can handle, and so loan forgiveness is important so that you don't have that debt when things come back and we get businesses back up and running. And then there's also Small Business Administration disaster loans. So please look at the guide there. We can get you information there. Obviously, we have the unemployment benefits as well for workers, and we have information there also. And I want to remind everybody too, there are folks in my office who work directly on casework to really help make sure that we can help you with specific questions you might have. And so please reach out to my office for more information after this call if you have specific questions and you don't see the information you need on the website. And thank you, John, for that question. And we're all working hard and look forward to seeing you back up and running.
Another quick reminder, you can press *3 at any time if you'd like to ask a question. Up next, we have Scott Olsen. Scott, you are live on the call.
Hi, Scott.
Hi there. Good evening. Thank you for taking the time, Representative, to speak to all of us. I appreciate it. My question was basically regarding additional data and testing. What I was curious about is, has there been any consideration to start testing people who might be asymptomatic or healthy just to get a better read on anyone who's a carrier versus anyone who's showing active symptoms? And additionally, is there any way to get additional details regarding infection rates for, Redmond, Bellevue, Kirkland, instead of just Seattle as a whole? So we could I'm just watching some of these trends from being inside my house, and just more data is helpful to kind of have an idea of when this thing will sort of pass us by.
So a bunch of important questions. One, King County has put up at least a website that shows where different cases are coming. I think it's by zip code, actually. So if you go to King County Public Health, you can see that, and that gives you some more granularity. Each county is handling that data separately, so FYI on that. I think we all desperately want to see more testing done. One of the biggest challenges we have is the availability of all of the necessary things that you need to do more broad testing, whether it's swabs that are used to get samples or the chemicals, the reagents that are used to help process the tests. Everything is in short supply, and so while we have done a good job, and UW has done a really good job of ramping up their testing capability, we still aren't at a place where we can expand to make sure that everyone who wants to be tested can be tested. And we want to focus also on healthcare workers to make sure they're getting tested right away so they can continue to be in the workforce. But let me turn over to Dr. Scott if there's anything he wants to add to that.
Yeah, so thanks for your question, Scott. At this time, we're not testing asymptomatic patients just because there's so many. In Congressman DelBene's district, there's 800 or 900,000 people, and the University of Washington can do about 3,000 or 4,000 tests a day. So that just would overwhelm our system if we did that. And so we're really prioritizing patients who are very sick, they're having shortness of breath, and then those patients who are vulnerable, so that's our older populations, patients who are immunocompromised, pregnant women, patients who have some kind of organ dysfunction. And so we really need to prioritize it for those populations. In the long run, Scott, I think what we're going to end up doing is some kind of an antibody test. It'll be a blood test to see if you have been exposed, but that's still in the works. And until that time, we're going to just have to get more testing sites and more of the other reagents and things like that to scale up.
Thank you.
Another quick reminder for those who are joining us, you can press *3 at any time if you'd like to ask a question. Up next, we have Adrian in Sammamish. Adrian, you are live on the call.
Hi,
Hello,
Adrian.
my name is Hi. Thank you for doing this town hall. I would like to know how many ventilators Washington State hospitals have and what is being done to increase that number, and maybe what's the best case number that we can hope to reach.
Thanks for the question. I can't give you the exact number that we have. We've been searching for more ventilators because in Washington State, we've had less ventilators per capita than other parts of the country. And so acquiring new ventilators so that we have them available throughout our region as cases increase has been a critical goal of our delegation and definitely of the governors. We recently just got 500 more ventilators from the national stockpile. The national stockpile has been taking medical equipment and resources that it has, like personal protective equipment, and distribute them based on need across the country. So we recently received 500 more. And then we've been working very closely with a local manufacturer, Ventec, which is a ventilator company in Bothell, and they actually have a partnership now with General Motors to increase production. I think this brings up an issue that's been an important issue across the board, whether it's the testing supplies that are needed, ventilators, as well as personal protective equipment, things like masks and gowns and gloves. All of these are in very short supply, and we need really a coordinated national effort to make sure that we are making everything that we need to meet the demands across the country. So ventilators are definitely one of those, and we continue to work very hard to make sure that we have available supply to address what we see our future needs as being, but it's going to take this coordinated effort in terms of manufacturing and distribution across the country. So thank you for that, and as we'll continue to work, I've led a letter with our delegation, working to make sure that we prioritize not only ventilators coming to Washington State, but this coordinated response nationally to have more ventilator supply. So thank you.
Another quick reminder, you can press *3 if you'd like to ask a question. Up next, we have Stephen in Bellingham. Stephen, you are live on the call.
Thank you.
Hi, Stephen.
My question is about regarding disease transmission and personal protection. If I understand right, patients are asymptomatic for at least several days, and that would, if they're accurate, that means they don't have cough or sneeze. Then personal protection, when we go out, we're on isolation, but you have to go out once in a while to shop. Then you're passing people, and if it's in their exhaled breath and it stays in the air for hours before it settles out, that seems like a risk. So if we have some masks, shouldn't we be wearing them?
I'm going to let Dr. Scott respond. I think he might be best to answer your question.
Sure. Yeah, Stephen, that's a great question. So COVID-19, or the SARS coronavirus type 2, is spread mostly through droplets. So this means that you have to be pretty close to someone who's either coughing, sneezing, or speaking very vociferously, and it does not get suspended in the air the way that like tuberculosis can. So the most efficient way is being within 6 feet of someone who's actively got the infection. So that's why we have that 6-foot barrier whenever you go out in public. And in terms of what you should do, I mean, it kind of depends on your overall health. If you're immunocompromised or have some other diseases, maybe you shouldn't go out at all, and see if there's other people who can do shopping for you, or you can have home delivery. But otherwise, we're not recommending that everyone have a mask to go out. We need to really save those for people who are in our hospitals and taking care of patients who have known COVID-19.
Thank you.
Thank you, Doctor. Just another quick reminder, you can press *3 to ask a question. Up next, we have Kirsten Incarnation. Kirsten, you are live on the call.
Hi, Kirsten.
Thank you very much. I appreciate your getting the information out. I'm going to definitely share this with a lot of the stuff I've learned with people on our local Facebook community pages. I want to ask two questions, one for the representative and one for the doctor. The representative one has to do, and I may have missed this because the operator was talking to me. Have you covered the whether or not there's any relief for people dealing with mortgages, whether on their home or their business? Because if they don't get their employment payment checks, even if they're backdated in time, they could have foreclosures on their homes or their livelihood. Is there a plan in place for that? Or is that already answered and I can find it on the recording?
I will answer that. But why don't you ask your second question of the doctor too? So then we'll answer both your questions at the same time.
Okay. Well, the doctor's a science question, and my undergraduate degree was in microbiology, so I'm really appreciative of our scientists and doctors who are the frontline information source for this. I appreciate your coming on here. When can we use the information we now know, and the research is being done, boots on the ground in the hospitals, epidemiologists studying this stuff in the labs, to actually target a proper government response by county, by community, by risk level, so we can put people back to work? I mean, I am a high-risk person because of my lung issues, but I know that with proper care, I can get back into work with the safety margins based on what we now know about the 3-day death, 3 days it dies on hard surfaces, the fact that unless someone sneezes full in your face, you're fine. I can get back to work, even with my risks. An 85-year-old with compromised health can't. When can you start advising, or other people like you start advising our leaders, so that we can start phasing back into the workforce to save our businesses and our jobs and everything that makes Washington great before it all goes under? Thanks.
Thank you. Why don't you go first, Doctor, and then I'll answer the mortgage question.
Kirsten, it's a really great question. And so, we're working on a variety of things. The first is vaccines, and there are several vaccine trials even here in the Seattle and Puget Sound region. We have several trials on antivirals. So those are enrolling, and we should start getting some answers, at least on the antivirals, in the next 1 to 2 months, some preliminary evidence. And I just want everyone to know that the pace of work on this is unprecedented. Just the fact that this was identified in early December, and then by the end of December we had genetically mapped this virus, and there was a test within 2 weeks is unprecedented. So everyone is uniquely focused on this. I think your question more is around, how can we understand the epidemiology and who's not at risk and who's been exposed and developed antibodies. That'll probably be a couple more months. I'm hoping, more in the May and June time frame, where we will have a little bit more about it. But we're still in the early stages, and we're trying to work as fast as we can.
Thank you, Dr. Scott. On the mortgage side, as part of the legislation we passed to homeowners with certain types of loans like FHA or USDA or VA or mortgages backed by Fannie Mae or Freddie Mac have the right to request forbearance on their payments for up to 6 months, and with a possible extension for another 6 months without fees or penalties. You should also contact your mortgage company because in many cases they have been trying to make sure that there is coverage for individuals given the terrible circumstances that we're in right now. So that is the first response is to contact whoever is servicing your mortgage. They can provide you more information directly on the type of mortgage that you have. We also know that we have eviction protections, and so if you're a renter, we wanted to make sure, obviously, that people can stay in their apartments or homes. This is an important time when we're telling people to stay home, that they have a home to stay in. So if there are ever problems with that too, and I know our Attorney General Bob Ferguson talked about this a little bit in a press conference today, if folks are getting mixed information on that, they should also make sure that they contact the Attorney General's office if they're being told to leave at this time when they shouldn't be. So that's a little bit of information to help there.
Just another quick reminder for those joining us late, you can press *3 to ask a question. Up next, we have Dana in Kirkland. Dana, you are live on the call.
Hello, thank you for having me. Ms. DelBene, your office has been great to work with. Thank you for backing us, small business owners. I have two questions. Number one, I've used almost all of my savings to keep my employees on payroll since March 1st. And now they are asking me to take them off payroll because they're going to make a lot more money on unemployment because of the CARES Act. And I'm in the food service industry. So if I take them off payroll, is it considered a quit or a termination, or how does that affect me as a business owner? And then my second question has to do with the SBA loans. As soon as King County came available, March 17th, I applied online. Long story short, after calling them every day and sitting on the phone for hours, they did tell me that when their computer system crashed, that all of my paperwork was lost. So I printed it all out and mailed it just Saturday. So now I'm at the back of the line there. I'm working with my local banker to get the payroll deferment loan. However, they say that that is not available yet. So I'm asking, I guess, when can we start seeing these loans and the cash in hand, because I'm out of money?
Thank you, Dana. I know that your story, and I've told folks a little bit about your story as well, because it is indicative of what so many businesses are going through. We can get you specific information to help you address issues on SBA, et cetera. I do know you definitely get benefits if you keep folks on payroll and keep paying them. And we have employee retention tax credits too that we passed as part of legislation. I know one of the folks on my team, Victoria, is also on the line. And Victoria, did you want to add anything on that?
Yes. So I'm happy to get you more specific information. I do understand that you are in a tough spot. We are encouraging people to keep, as the Congresswoman said, to keep their employees on payroll, and we are providing that employee retention credit. It would just unfortunately need to be on a case-by-case basis. Maybe the commissioner has a little bit more information about the unemployment insurance benefits and how providing those versus keeping them on payroll would benefit. But I understand that you're in a tough spot. I'm sorry about that.
So this is Susie LeVine, the commissioner for ESD. Thank you so much for your question, Dana. I don't know if your business is still up and running and your food servers and your food services individuals are still working right now in terms of doing the business, or whether you are simply paying them and they are not in the office. But there's a couple of different options available for you depending on the circumstances. For one, if you've had to close your business, you can put your workers on standby and they can obtain unemployment insurance. And if you've had to close your business for the purposes of COVID-19 for some catastrophic closure, you also would be relieved of benefit charges in terms of anything for your rate increases going up. And if those employees are part-time or less than full-time, we have expanded standby to include those workers as long as they have the 680 or more hours. That said, the CARES Act now will include those individuals who have fewer than the 680 hours. So they would be covered either now with existing unemployment insurance or with the expanded unemployment assistance from the CARES Act. Another possibility would be shared work. And shared work allows you to reduce the hours of your employees. If you're still up and running, but you don't need quite as many hours, you can reduce their time anywhere from 10 to 50%. And unemployment insurance does partial wage replacement against those reduced hours. And again, the CARES Act is paying 100% of those costs associated with shared work. So it would not impact your unemployment insurance rating in the future. Those are a couple of the options that you could have. If, however, you are still up and running and you are paying them and they are doing work, you asked if it would be considered a quit. It really depends on the circumstances. If you are doing essential work and they choose to leave, then that could be considered a quit. If, however, you have reduced your operations, there are other options available. We can also follow up with Representative DelBene's office and try and get more of your circumstances in order to provide you with a more direct answer to your situation.
Thank you. Thanks, Dana, and thanks, Commissioner.
A quick reminder for those still joining us, you can press *3 to ask a question. Up next, we have Janice in Richardson. Janice, you are live on the call.
Hi, Congresswoman. How are you?
Good. How are you?
We have been in the trenches since early on in Kirkland, and my husband has been taking groceries to shut-ins, handicapped, veterans, single moms, pregnant women, but I don't see anything going on locally here. I don't see any communication organization, and they shut the Senior Citizen Center early on, and they're not on Facebook. I'm quite concerned about them. Can you fill us in if there's any planning coming forward, please?
For seniors and for veterans, did you say? The two?
Handicap shut-ins, people in need.
No, it's a great question, and there's been a lot of work, and we've had a lot of great organizations, nonprofit organizations working to help too. I know our senior centers have been working to check in and to also help provide meals, since in many cases there are places where people were coming together for meals every day. Now there are doing meal deliveries. And one of the things that we had in the CARES Act and some work also in the bill before was to make sure that we had resources to cover the increased costs of food and food deliveries for supplemental nutrition program, but also for food for seniors, for students, programs like Meals on Wheels to get to a lot of folks who would not otherwise necessarily have those resources available. There also has been a focus too in terms of providing funding, particularly for support services for veterans. And we have a guide up on my website, again, under the COVID-19 tab that has a particular guide specifically for veterans. So there's some more information there.
Up next, we have Deanna in Marysville. Deanna, you are live on the call.
Hi, Deanna.
Hello. Hello. How are you guys doing?
Doing well. We're all connected on the phone all day these days.
Yep. So my question is about the CARES Act, and I read online, I'm actually reading directly from this article, I believe it's from the like the CBS or something like that. But it says that people from ages 17 to 23 who are college students or part-time and can be claimed as an adult are not eligible for any form of payment from the CARES Act. And I was just wondering if that is correct, since I am personally 20 who's going to school and lives on their own and works full-time, and that's kind of concerning to me since my parents don't help me. So yeah, I was just wondering if that's true or what makes you eligible or doesn't make you eligible for the CARES Act.
So there's two different pieces, I think, that are important here. One piece is the direct payments. There are direct payments as part of the CARES Act to adults who of $1,200 per individual. These are individual filers, tax filers, and $2,400 for a married couple filing jointly, and then $500 per child. I think if you are on your own and are independent right now, so you're not dependent on someone else, then you would potentially be eligible for that. And then obviously if you're not working or had been working before not working, then there's the unemployment side. So I'll let the commissioner talk about unemployment, but if you are claimed as a dependent, and this is the difference, if you're claimed as a dependent, you won't receive the direct payment. But if you are not claimed as a dependent by someone else, you would. I just want to make sure that part is clear. You said you were independent, so I'm assuming you were no longer claimed as a dependent. But if you are claimed as a dependent, then you would not get that same benefit. And then on the UI side, Commissioner, did you want to add anything?
Yeah. Basically, if she is out of work, Deanna, if you're out of work, you are conceivably eligible for unemployment insurance or the unemployment assistance from the CARES Act, depending on the circumstances. I encourage you to go to esd.wa.gov, and we will be providing a lot of information, and actually we already have a lot up there with the frequently asked questions. Your eligibility for that does not depend on your age. It depends on your employment status. If you, as a student, have been working part-time, if you typically work 13 hours on average per week, then you're probably eligible for unemployment insurance as it is today. If you have fewer than 680 hours over the past 12 months, which is our threshold in Washington State, then you will most likely be eligible for the unemployment assistance out of the CARES Act that we are also going to be administering. So it depends on your circumstance, but unemployment insurance would be something for you to consider if you are now out of work. We have a lot of students across the state who have various part-time jobs and do not accrue 680 hours over the course of a 12-month period. And so for many of them, the CARES Act unemployment assistance is going to be the right solution for them.
Thank you.
Up next, we have Robert Savage. Robert, you are live on the call.
Hi, Robert.
Hello. I just had a couple questions. One, how bad does it need to get before we actually do like a countrywide shutdown similar to what England did? And then the second question was Trump is consistently talking about all the PPE and the federal government has sent out, but I have friends and family that work at Providence and another medical facility that say they haven't gotten any or just haven't gotten enough. When can they expect to get what they actually need?
Thanks for both of those questions. In terms of a federal order, like a federal order to shelter in place, I actually think this is a place where the states have led, and so this has been a state decision, and states have made the decision to shelter in place, and sometimes different parts of the state have made that decision. I believe that that's really where we're going to continue going forward, is for states to take the lead and make those decisions for the state. There definitely is guidance like we get from the CDC to continue to inform our communities, and we've definitely seen increases of cases in parts of the country that hadn't seen as many cases early on. But again, I think the states will primarily be leading there. And then on personal protective equipment, it is a great question. And the very, very disappointing thing is that we have a scarcity across the country. We have been getting some resources from the national stockpile, but those are going to our tier 1 needs, and those tier 1 needs are really healthcare needs and first responders who are working with patients who could be positive. So we need more, and there are folks working hard to set up manufacturing capabilities domestically. There's a lot of worldwide demand here, which is also making things more challenging with scarcity. I do think we need a coordinated national response here. I do think that the states have really led and been working to get protective equipment separately, but we need a federal response, so these are not states competing with each other for equipment, but there's a federal response to do as much manufacturing as is necessary to make sure that we are fulfilling needs and to distribute that to the neediest parts of the country. And we do not have that really coordinated response I'm talking about happening nationally. So a lot of it has been a push at the state level. And so we continue, and we're talking again with FEMA today to push for that national response so we can make sure everyone has the protective equipment that they need.
Up next, we have Connie Hope. Connie, you are live on the call.
Thank you. Thank you very much for being there today. My first question was actually about the PPE equipment that you were just mentioning, Susan. You say that there needs to be this coordinated effort and that FEMA is the one to do that? Is that correct? I mean, who would be making sure that this happens across the country like that?
Well, one of the things is the defense. There's a law called the Defense Production Act, which allows the federal government to use capacity across the country to produce emergency products like these. And I think there's more that could be done to coordinate. A lot of folks are doing what they can to jump in and make materials. But when I talk about a coordinated response, it's knowing the needs that we have across the country for each individual product, knowing where there's capacity to produce it, making sure those raw materials are getting there, and tracking all of that in a coordinated way so that those materials go out. Right now, our state is sourcing all of these materials and getting distributions from the national stockpile, but so is every other state. We were one of the few at the beginning when we were hit very hard, but now that a lot of the country is hit hard, we have a lot of materials going to, being spread thin across the country, and everybody is trying to source internationally as well. So when I talk about a coordinated effort, that using that combined effort under the Defense Production Act, I think is important for us to maximize the return on all these materials, know what we're producing, and know when it's going to be available so that we get ahead of demand.
Congresswoman, this is Dr. Scott. I'd be happy to chime
Go ahead.
in on. So, Connie, the other thing that's going on is regionally we have daily phone calls amongst all the healthcare systems, and that we're keeping track of things like PPE and also ventilators. And there has been load shifting and sharing going on. So we are tracking this locally as well, and we're sharing when one system has more and to a system that doesn't have as much.
Yep. Up next, we have Jack from Renton. Jack, you are live on the call.
Hi.
Jack.
Thanks for taking my call. So I'm having trouble visualizing what's on the other side of this thing, because people are, even if after the curve happens and supposedly we start to crank things back up, I'm not visualizing how we can ever engage in the same kind of lifestyle where people get together at a restaurant, at a bar, and all these jobs in the service industry. I'm not seeing how they can ever crank back up again. I mean, does a vaccine have to happen for that to take place? And that's a year and a half out or so, and I'm not getting that vaccine, I can tell you that. And I mean, we're hiring, but who is going to be who's going to be all out of work? I mean, our company Zip Techie is hiring, but that's a virtual support thing. But all the people that are in the service industry, they're how are they going to get back to work?
Thank you for the question. And I know that as folks have looked at models, et cetera, one of the things the doctor referred to a little bit was kind of blood testing to find out who has experienced the disease and might have developed antibodies. So let me turn it over to Dr. Scott to talk a little bit about that.
Yeah, so Jack, I don't know if you were on the call earlier, but someone asked about additional data and testing, and some countries have already done antibody testing. So you can test if someone's been recently infected or if they've been infected in more than a month out, and that might show if you had it asymptomatically. And we think that if you have antibodies that you're at least temporarily protected. So that might be a strategy that we do, blood testing, and if you're positive for it, then we think you have a temporary immunity. But you're right, I mean, the ultimate solution would be widespread vaccination, and we think those things take time, and probably in the 12 to 18-month time period. So this is what a lot of us are working on. What is the short-term solution before we have the vaccine? What can we do to get people back to work in a safe fashion? Because, as you know, as soon as you lift these social isolation, people can spread it again, and we don't want to keep doing that.
Thank you. We have Rebecca in Snohomish. Rebecca, you're live on the call.
Hi.
Hi, Rebecca.
I am an independent contractor, and my job is pretty unique. I put out real estate signs on the weekends, but we also know a lot of hairstylists, also independent contractors. So I appreciated the speech at the beginning about how it's going to be kind of more in mid-April that we'll have more questions, but just that we have, since we would not normally qualify for unemployment, we have unique, things like you get paid by the haircut, not by the hour. Do you have a plan to help us out with those questions, since there's so many people applying, or a special way in your website that we could explain the circumstance? And then also, some of us, I expect to go back to my job when this kind of comes to a close. So should I be looking for work if I expect to go back to my job?
I so appreciate that question. Do you want me to take that?
No, go ahead. I was just going to say you should answer. So go ahead.
Perfect. So if you would, after this call, please go to the website esd.wa.gov to sign up for our COVID-19 action alerts. We are going to be providing instructions and information for folks to both gear up and get ready, as well as the heads up when the updated system launches. You are spot on, and I really appreciate you recognizing the different circumstances that you have versus somebody who is a typical hour and wage employee. This is why it's going to take us about 3 weeks to get our software updated so that we can accommodate through our automated system the applications for this unemployment assistance for independent contractors, 1099 folks, and those who have fewer than 680 hours or are part-time workers. So we'll need things like past tax records to establish earnings, things like that. We actually have done this type of thing on a very small scale and in a very manual way in the past. Disaster unemployment assistance happens when you have a natural disaster like we had with the Oso landslide, which I know impacted your district, Representative DelBene. But we were able, because it was a relatively small scale, to handle that in a very manual way. And it's at those times that, again, eligibility for unemployment assistance gets extended to those impacted but who are not otherwise eligible for unemployment insurance. So even in that instance, people who were independent contractors who were impacted could apply. So we have the manual process, but what we are working on now is the automated process because of the scale. We would never be able to handle this from a manual standpoint. As wonderful and amazing and Herculean as my team is, we need to automate this. We also will have a checklist online for folks for the materials that they'll need for their application process. And again, it'll all be posted up on the website. There's already a treasure trove of information up there for those who are already applying. And like I said, we'll keep people updated with what we'll need from them. And then in terms of your question around should you get a job now, there are many jobs that are non-permanent positions, including unemployment insurance, claims agents, where we need help. We are hiring hundreds of individuals in the coming days, weeks, and months. And so there are non-permanent as well as permanent positions. So we would much rather people have a job than have unemployment insurance. And so we have positions, and many other folks are hiring even on a non-permanent basis.
Thank you.
Unfortunately, that's all the time we have for questions. If you didn't have a chance to ask your question during tonight's call, please note you'll be able to leave a voicemail for the Congresswoman and her staff simply by remaining on the line. With that, I will turn it over to Congresswoman DelBene for some closing remarks.
Thank you, everyone. Thanks for taking the time. I know we could talk for a long time, and we'll continue to put resources up. And again, please leave us a message, and we'll follow up with those of you who were not able to ask your question on the phone tonight. I know this is a difficult time, and I hope this conversation was helpful as we all work together to battle the COVID-19 outbreak. I also want to thank Commissioner Susie LeVine and Dr. John Scott from UW Medicine for joining us and for answering their questions and all of their expertise. When we finish here in a minute, you'll have the opportunity to leave a message with any further ideas or questions, and we will follow up. I want to underscore again that my focus at the federal level and the work we've been doing in Congress, the focus is protecting families, workers, and our small businesses, and getting our healthcare system the resources it needs to continue to save lives and protect our families. A reminder that my office today released a series of resource guides that I talked about earlier, and about how to access benefits in the CARES Act. Those are on my website. It's delbene.house.gov. And just click on the COVID-19 tab. Again, thanks again for taking your time today to join me, and stay safe and stay healthy.